Hi there, I'm Dr Nikki Kanani. I'm a GP in London and I'm also the Deputy Lead for the vaccine programme at NHS.
Hi, I'm Riyad Karim. I'm Assistant Director of Primary Care in Enfield, NHS North Central London ICB, that's the Integrated Care Board. I'm heavily involved in local partners in planning and delivery of the COVID-19 vaccine in Enfield with a focus on equalities and engaging communities.
Thank you both for joining me. Nikki, starting with yourself, this is the first winter without restrictions since the outbreak of COVID-19. What are your top tips for how we can boost our own and our families' health this winter?
We've been really lucky that this is the first winter that we've been able to come together with more of our friends, families, our loved ones. And that is because of our incredible vaccine programme. What that's meant is that we've been safe enough to come together. And it shows how important it is to make sure that we can do more of that over the coming months and years, especially when we have important festive occasions. So having your vaccine is very important. If you're invited for your COVID vaccine or your flu vaccine, please come forward if you haven't already had it. It's not too late to get vaccinated. And make sure that your family is up to date too. We know that only 50% of our British South Asian adults, so that's Indian, Pakistani, and Bangladeshi, have had at least 3 doses of our COVID vaccine, compared to over 75% among white British groups. So please, it's not too late to get protected. It's also really important to maintain your wider health as well. So making sure you attend your routine appointments, that might be for your long-term medical condition, to review your medications, making sure that you get your screening appointments fulfilled as well. So that's your cervical screening, breast, lung, eye screening if you've got diabetes, or bowel screening kit that's sent to you at home. These are still life-saving opportunities. And of course, if you've been unwell, and particularly if you've been unwell for a while, maybe a cough that's lasted for more than 3 weeks, blood in your urine or in your stool, your poo, or changes in your breast tissue, then talk to your GP practice, because we're all here to look after you. Your NHS is here for you.
Thanks, Nikki. It's important to know where to go if you or your family have a problem, and this ensures that you're seen quicker by a skilled professional who can help manage your health concerns and give you the treatment you need. You can go to a local pharmacy for advice about minor ailments, symptoms, or existing prescriptions. And pharmacists are highly trained health experts who can give clinical advice and over-the-counter medicines for a range of minor illnesses. If symptoms suggest it's something more serious, the pharmacist can tell you if you need to see a GP, a nurse, or a other health professional. Many pharmacies are open quite late and at weekends, and most have a private consultation room where you can speak without being overheard. And you can go to a local GP practice for most preventative pregnancy, physical, and mental health advice. You can go to a minor injuries department for help with cuts, sprains, strains, and minor burns, and ring 999 or a local accident emergency A&E department for serious or life-threatening conditions. And then there's a free NHS 111 service, call or online, for advice about an illness or to book an urgent health appointment in the right place. Indeed, if you need medical help fast, and if it's not life-threatening, and you're unsure what to do, NHS 111 can help. Visit 111.nhs.uk or call 111 free from your mobile or landline. The service is available 24 hours a day, 7 days a week, and can help assess and direct you to the most appropriate local service, including a GP practice, local pharmacy, or your nearest urgent treatment centre. If needed, NHS 111 can arrange a callback from a nurse, doctor, or paramedic.
So, Riyad, what has the NHS learned in terms of preventing ill health in communities such as the Asian community from the pandemic?
That's a great question. More than 144 million doses of the COVID-19 vaccine have been given in England. And from this, the community has learned more about the infectious diseases and how they are spread, and about the importance of vaccines and immunizations, and limiting the spread, for example, by not visiting older or vulnerable family members if we are ill. The NHS has seen the importance of building trust with our communities, and we've worked with faith, business, and community leaders to share information about how people can protect their own, their families, and their community's health. And we've made sure that people can access vaccinations within the community, for example, by locating vaccination sites in more local settings, such as community pharmacies over time, and by developing walk-in and mobile site options.
As Riyad says, we've learned so much from the pandemic, haven't we? And it's easy to forget how difficult and dark those first few months were. But as the vaccine program rolled out, as Riyad described, we've been able to work with local communities and with our business and faith leaders to really build confidence and trust in vaccination. And it's been fantastic. We've all been involved. National and local colleagues have joined all sorts of events, many that you'll know as well. So we've been in Melas across the country. We've taken vaccinations to Garba and to Navratri celebrations, to Diwali in the Square, to the London Halal Food Festival, to the Bangladeshi Caterers Association, loads of opportunities to make sure that we help people understand how vaccinations work and how to get them and how to protect their communities, our communities. We've had colleagues supporting the Kashmiri Development Foundation, who went door to door with Kashmiri residents, talking about the importance of COVID vaccinations and, discussing concerns about other things, including wider health needs as well. That was across Rochdale, Luton, Nottingham, Birmingham, many other areas. And then some brilliant locally tailored offers, so things like a booster with a bhajia at an Indian restaurant in Bradford, which offered a free appetizer to people as they got their vaccine. The pandemic also showed us that people are living with undiagnosed and treatable conditions, which put them at risk of ill health and actually mean that they get more unwell when they get COVID as well. So we need to make sure that people get those early diagnoses, that early treatment for conditions that they have, and making sure that people get support and education so that they don't get ill in the first place. And if they do get ill, how to access that treatment, that support, so that we can all live longer and happier lives together.
And Nikki, further to that, how can we make sure that people are diagnosed earlier with conditions that they might not have ever noticed yet?
There are some really practical things that we can all do, or we can make sure that our friends and family do, to make sure that we get the right care, the right diagnosis as soon as possible, and the right treatment when that's needed as well. So first of all, if you're aged over 40, get your blood pressure checked. There's lots of ways you can do this, but blood pressure is really key because that is a silent killer. It increases your chance of getting a heart attack or a stroke. And there's lots of ways you can get your blood pressure checked. Obviously, many people have blood pressure machines at home. You can get it done in your pharmacy. In our practice, there's a blood pressure machine in the waiting room, so you can just walk in and get it done. And it's also a part of your wider health check that you're offered over the age of 40 as well. Of course, please attend your routine appointments. People with who are living with a learning disability or a severe mental illness should have an annual health check. And if you have a long-term medical condition or a disability, you might be invited for a review as well. And that means that we can pick up issues really early and often before they become a problem. As I've mentioned, if you're invited for a screening appointment, so cervical, breast, diabetic eye screening, please come forward for it. Each year, at least 10,000 lives are saved by screening alone. And as I mentioned, if something doesn't feel right, you can go on your general practice team website, or you can speak to your practice. You might have had a cough that's lasted over 3 weeks, blood in your urine or in your stool, your poo, a lump or bump in your breast or a change in your mole. And you know what, when people come forward, most of the time, I can reassure my patients that there's nothing to worry about. But if it is serious, it means that we can investigate and treat you quickly and as safely as possible. And of course, please make sure you get your vaccinations. All the NHS vaccinations have been well tested and have been used to protect our health, our community's health for a long time. So make sure you keep up to date.
And further to that, are the COVID and flu vaccinations suitable for everyone in our community, including vegetarians or people who don't eat pork or beef?
That's really important. So all our NHS vaccines are safe and effective, and there's been a lot of testing, extensive testing on thousands of people, including those from our communities. And this means that all of our COVID vaccines currently offered, including the next generation, what we call the bivalent vaccine that covers the original and the newer variants of the virus, have been fully tested and have passed all of the tests. Sometimes people with a long-term condition or with an autoimmune disease are at more risk of becoming seriously ill with flu or COVID. So sometimes they're invited for additional doses, particularly of the COVID vaccine. And so that's an important opportunity as well to get protected if you're living with a long-term condition.
Thanks, Nikki. It's so important to reassure communities that the vaccine is safe and effective. And from the beginning of the vaccination program, we've owed great thanks to many religious and faith leaders who've given their time and support to make sure that their communities could access the vaccine. We've hosted clinics in churches and synagogues, gurdwaras, holy temples, mosques, and community centres. And it's important to note for you and your families that all NHS COVID-19 vaccinations are free from gelatin and all other animal products. There's no egg, beef, pork. Muslim jurists have said that these are permissible and suitable for a halal diet. And although some flu vaccines contain egg, there are also low egg and egg-free vaccines available. Children over the age of 2 may be offered a nasal spray flu vaccine, which contains small traces of porcine gelatin. If you find this unsuitable, you can speak to your GP practice about the injectable vaccine that doesn't contain gelatin.
Nikki, do you have any advice on what people should do if they're feeling poorly with a cold, flu, or COVID?
I've got a few tips to help you take care of yourself or a family member if you do have a cold or if you have the flu virus. First of all, it's really important to get plenty of sleep. Rest really does help your body to recover. I'm a big fan of drinking plenty of water and warm liquids to stay hydrated. That will really help. Stay really warm, lots of blankets and extra layers, particularly with the weather the way it is at the moment. And of course, paracetamol or ibuprofen can help with any aches and pains, and it also helps to lower your temperature as well. If you have to go out, then please try and wear a mask, but obviously try and stay in because it's better to rest, as I said. And of course, try and stay away from older family members or anyone with underlying health conditions because they tend to be more vulnerable.
Do you have any final words on why we need to still have our COVID and flu jab?
It's really important to know that it's not too late for you and the people in your family who are eligible to get your vaccinations. The flu and COVID vaccinations keep you safe, keep your family safe, keep people around you safe. It means that we can come together more than we ever have done over the last few years. But it's really important to remember that COVID has not gone away. It's still making people feel ill every single day.
Thanks, Nikki. If you or a family member, including a child who may be eligible for a free flu vaccination, have been invited for a vaccine, please come forward. You can find out more and book your COVID and flu jabs by calling 119 or online at www.nhs.uk/winter vaccinations. Please do note, we are still offering flu and COVID vaccines to those who qualify in surgeries, pharmacies, and vaccine centres very near to wherever you are. If you don't qualify for a free flu jab, then many pharmacists will be able to offer you a paid one, which could be a very good investment if it means that you don't get sick and have to take time off work. If you've previously been declined a vaccine, then you're free to change your mind at any time. If you just want a no obligation and completely non-judgmental chat about vaccination, your GP, pharmacist, or staff at your local vaccine centre are always happy to speak to you.
Riyad, thank you so much for your time. It's been an absolute pleasure speaking to you.
Thanks for having me on. Great to talk to you, Nikki, as always. It's been a pleasure.
Nikki, thank you so much for your advice and guidance here. It's been an absolute pleasure.
Thank you so much for having me. It's been a pleasure to join you.